Hi, my name is Pam Achabal, and I'm an ostomy wound care nurse. Today, I'm going to be presenting on ostomy care and peristomal wounds and talking a little bit about the Hydrofera Blue ostomy ring and how it may help some of your patients. Some studies report up to 79% of people with an ostomy experience a peristomal skin irritation. Normal, healthy peristomal skin should look similar to the patient on the left. The skin around the stoma should be intact and without irritation. Unfortunately, as clinicians, we often see the damaged peristomal skin, and that can happen if the opening on the barrier is too large or it does not adhere well. The drainage from the stoma can damage skin. Skin may have become damaged from an incorrect or a frequent removal, and it becomes itchy, blistered, and weeping. Pyoderma is characterized by painful and necrotic ulcerations in the area surrounding a stoma. The Hydrofera Blue Classic Ostomy Ring is a unique antimicrobial wound dressing that can be used under ostomy barriers. It manages bioburden, which can help the body's own immune system restore bacterial balance. It provides a broad spectrum of activity against a wide variety of bacteria and yeast. This is a chart that shows the different bacteria that it's effective against. One thing I like to point out is the yeast that it's effective against, because yeast is very common under an ostomy appliance. The ostomy dressing must be placed on the wafer dry to allow the film side to stick to the ostomy barrier. The ring can be put on as the entire ring if the wound and the peristomal area around the stoma dictates, as you see in this picture. If you just have a small lesion, you may want to cut just a piece of the ring to cover the wounded site. The ostomy dressing is very thin and has wetting agents in it, so it will soften up when in contact with a moist wound. And typically, you do not need to hydrate the ostomy ring. One tip to remember is what we call the DD rule. Dull side down on the skin. Shiny side, as you see in the lower right, goes against the wafer. One exception to wetting the ring would be if your patient has pyoderma. If a patient has pyoderma lesions around the stoma, the ostomy ring may be lightly moistened. To do this, you simply moisten your fingertip, as you see here, with a little bit of water and rub it on the foam side of the ring. This will soften the foam. Keep the shiny side of the ring that you see here, keep that area dry so that it goes next to the wafer and it has a good firm grip. Ostomy ring application instructions, it's actually very simple. It's as simple as 1, 2, 3. Trim the inner diameter of the Hydrofera Blue ostomy dressing to fit around the stoma. If needed, you can trim the outer edge of the dressing as well. You apply the film side of the dressing to the ostomy skin barrier, and then 3, apply the skin barrier to the skin. A new Hydrofera Blue ostomy dressing should be applied when the skin barrier is changed, and that's usually about 1 to 3 days, depending on the level of exudate and the condition of your patient's wound. There are a few other tips when using the Hydrofera Blue ring. You might want to consider using an ostomy belt or using a skin barrier that has a tape border. Also, consider using a larger skin barrier to ensure there is adequate skin barrier around the outer circumference of the Hydrofera Blue ostomy ring, similar to what you see in this picture. You need about a ½ inch of skin barrier extending beyond the ring. So why does peristomal skin break down? Can be a variety of reasons: appliance fit, allergies, bacteria or yeast, skin stripping, an incorrect opening size, or leakage. One of the things to remember that Hydrofera Blue Ostomy Ring is not just an accessory, it's actually a treatment, and it's a solution to irritating wounds around your patient's stoma. Let's review a few case studies in where we have used the Hydrofera Blue ring. First case study is a patient with Pyoderma. He's a 78-year-old man with a urostomy and type 2 diabetes and a variety of other comorbidities. He had very painful peristomal pyoderma lesions around his stoma. When we first started the Hydrofera Blue ring, his pain was an 8 out of 10. At day 14, after using the Hydrofera ring, his pain was down to a 5. Day 28, his pain was now down to a 3, and we had healed significant number of the lesions. We healed this patient at day 46, and his pain had gone down to a 0 at that point. This is another urostomy patient, 70-year-old retired teacher. She had circumferential breakdown that began right after her urostomy surgery and could not get this area to heal. She had had this breakdown for a solid 2 years before she finally came in to see a clinician and get some assistance. The nurse practitioner began using the Hydrofera Blue Ostomy ring, and you'll notice in this picture there's white. The white is normal on the Hydrofera Blue products. What we say is when it's white, it's lost its fight, and it's basically doing its job. The bioburden from the patient's wound has been killed and taken care of in this particular wound. And then it allows that wound to start to heal. So you can see you're getting some epithelialization around this stoma site. This is one of the most recent pictures, and you can see more epithelialization surrounding that stoma. It's still not perfect. However, with the use of the Hydrofera Blue ring, it is getting better incrementally every dressing change. One of the questions that I've received quite a bit is, can I use a piece of the Hydrofera Blue ring? And the answer is yes. Similar to as you use a piece of a barrier ring, you can certainly use a piece of Hydrofera Blue as well. These cases are highlighting exactly what I just talked about, using just a piece of the ring. This patient on the left had a pressure ulcer, and he was diagnosed, had MRSA. They started using the Hydrofera Blue just in these areas where you see this breakdown. 8 weeks later, that wound has healed. Clearly he didn't need the entire ring around the stoma. Similar with this patient to the right, quadriplegic with peristomal wounds, etiology unknown. We started just pieces of the Hydrofera. 2 weeks later, saw significant healing, and the patient went on with no further lesions. This is our last case using pieces of the Hydrofera. I love this case because this patient had a history of Crohn's, and the wound was present for 5 months. They did suspect pyoderma, and they used a small piece of the Hydrofera Blue Ostomy ring, as you can see here. And it was correctly applied. The shiny side is up, the dull side is down. 3 weeks later, you can see a significant improvement where you have a thin strip of epithelial tissue here, and significant wound healing at this point. At 6 weeks, you have a smaller wound, and then at 10 weeks, the wound is completely healed. Hydrofera Blue, this is a family of products on this particular brochure, but Hydrofera Blue is just one of a variety of different products that you can utilize for your patients. The diameter of this ring is a little thinner, and it makes it a little easier to go under an ostomy appliance. We also have a product selection guide to help you select the very best dressing for your patients. If you have any questions, certainly feel free to email those questions